I'm Elspeth. I'm a consultant paediatrician with an interest in paediatric allergy, and I've been asked to talk to you this week about allergies in children. So the first question, how do I know if my child has hay fever? Children have hay fever with very similar symptoms to adults, so I tend to think in the main part it's the nose or the eyes. So the eyes, they can be itchy, watering, and sometimes quite painful. In terms of the nose, some children have a very blocked nose, some people have a very runny nose, lots of sneezing. And for some children, they can get a lot of nasal congestion, it drips down, and they can have a sore throat as well. So they're generally the main symptoms. And then the question that goes hand in hand with that is what causes hay fever. So hay fever is the term we use when people are having an allergic reaction to a pollen. And the most common pollens to cause that here in the UK are tree pollens and grass pollens. The tree pollen season starts usually around mid-February and goes through to late spring, and then the grass pollen season takes over. There are some people who have hay fever symptoms, but they're triggered by house dust mite allergies as well, and they tend to last all year round. Will my child show symptoms of the allergy all year or all the time? So it really depends what the trigger is. If your child has a pollen allergy, then you will know that because of the seasonality of it. So either an early spring through to late spring allergy or a late spring summer allergy. Things that people find quite helpful, you can download pollen apps for free, and on the days when there's a high pollen count, I tend to talk about that on the weather forecast. But as children get older, they'll tell you, they'll wake up and they'll say, oh, it's a bad pollen day today. For those children who have a house dust mite allergy, they can have symptoms all year round. Conversely, they tend to get a little bit better in the summer because we're outside more, and we've got the windows open more. But it really depends on what's triggering as to when they'll have their symptoms. So what treatment is available over the counter to treat hay fever in children? And one of the first things I'd say is you can't avoid these allergens. They're there, they're in the air, but there are things you can do to help. So for example, if it's a high pollen count, don't hang the bedding out to dry on the washing line, dry it inside. And on days with high pollen counts, often we say change your child when they get home and just move bath times. So have a shower or bath when they get in and change into clean clothes. Lots of people find wearing sunglasses really helpful if they have bad eye symptoms. There are lots and lots of other antihistamines which don't sedate, and talk to your pharmacist about that and they'll advise on the right one for your child's age.